Alrighty, so now it looks like we're live. Hello, Dr. Ross, and welcome again. Thank you for joining us on this lovely Wednesday in June. Can you believe we're in June already? Half the year is gone.
Yeah, I'm getting ready for Christmas.
Yeah, start shopping now, get the good deals. So today I understand that we are talking about stem cell therapy and how it works on rejuvenating, particularly joints, and just keeping your whole body youthful
Yeah.
and feeling, good. And, not that I don't know, I feel like as soon as I turned 35, like things
Yeah.
started creaking and cracking that shouldn't be. I'm like, oh no, what's happening? So tell us a little bit about it.
Awesome. Love to. Thanks for having me. Oh, there goes my wife. She just decides to jump into the screen. Yeah, I have a background, but you jumped through it. All right. Let me turn on my slide present. Well, actually, I have to do a transfer, right? Take over the screen.
Yes, turn it on and go ahead and do the whole screen share.
Present, right? There we go. Oh, look, you've got one too. There we go.
One that's coming into the screen. Hold on.
Exactly. All right. I think this will do it. Can you see it now?
I see it. All right. It is live and on the screen. Thank you. I'm gonna go ahead and pop myself up. You have the whole screen.
Thank you so much. Thank you guys for joining and watching. Today we're going to talk about stem cells and really how we use it to not only work with joint pain, which is the most prevalent conditions typically. It can work with rejuvenating really anything in the body, including your skin, you name it. So I'm going to get to I'm going to go over exactly how this process works because it's very misunderstood by a lot of people. And I first want to thank you for being here, like I said, because really you're investing your time in something that's so critical. This seminar is really for people. That's what we're going to talk about. Who it is really for. How do stem cells work? What conditions it helps? How does it eliminate joint pain? Is it safe? Do you need to go overseas? How do you pick a clinic? The questions I typically get asked all the time about doing these type of procedures. So it's great for people that have osteoarthritis, maybe, or know someone who does, maybe have chronic pain. They've limited their activities. They're just not enjoying their life. They may be taking a lot of medications. So if you're looking for long-term solutions so that you can enjoy your normal activities and restore your life, this is what we're going to talk about. So back in December 12th, 2021, which was a year and a half ago, I had what I consider a miracle. And let me tell you what that means. I achieved something that was told by many experts years earlier that would be impossible to do without having surgery. And so what it was here I am. I ran a marathon. So in West Palm Beach, where I live, I ran this marathon. Now, why is it a miracle that I ran it? Well, if you've never run, then it could feel like a miracle in general. But the primary reason is because I had torn my ACL 10 years prior to this. And I was told that I would need surgery to resolve it. And if I didn't get surgery, it would continue to get worse. And eventually I'd have a lot of issues and not be able to do a lot of activities. You see, back in 2011, I decided I wanted to take up dodgeball, which was not a good idea because I tore my ACL. And I went to multiple orthopedists, and they basically told me the same thing: is the only way to fix this problem is with a surgical intervention where they replace the ACL with either cadaver tissue or my hamstring muscle, both of which sounded like a bad idea to me, So I decided I wasn't going to do that. And so after deciding that, I had to find a solution because I was really not walking well. I was kind of favoring one leg. I couldn't work out like I used to. Everything was a concern. Eventually, And I was doing physical therapy, but it just wasn't fixing the problem. So long story short, eventually I found out they were doing stem cells out of Asia. I flew there, learned about stem cell therapy, where actually they were using perinatal tissue, which is the placental tissue after a woman's had a baby. They were recycling the cells and injecting it into the joints of many people, and they were getting miraculous things. I had it done, and it fixed my problem. Within 6 weeks, I was back to normal. It was as if I had never had the injury in the first place, which was, I'm telling you, a miracle. And the reason it was a miracle for me 10 years later is because it lasted. It wasn't a short-term fix, like, taking a medication or even sometimes surgeries. It was a long-term solution. So I became very excited and really uh, started using these procedures in our practice. And then I got a fellowship in stem cell therapy back in 2017 from the American Academy of Anti-Aging Medicine, which was a year-long training, which was really good. I wrote a bunch of books. Reprogramming Youth is my current one, as you can see there. I don't know if you can see on my screen. I'll hold up a copy. This is the hardcover. Maybe you can see it, maybe you can't, I don't know. Anyway, so it's a fantastic book. It has like 70 different research conditions. So if you're interested in learning about regenerative nanoparticles or exosomes or stem cells, this has a lot of research on how to resolve many different conditions. So that's the recent book that I have. I was actually featured in Tony Robbins' book as well, Life Force, where he listed me as part of his amazing healing team, which I was very honored to receive. So I'd say I've been around the block in this area since 2011. Really is when I got started in all this. So let's talk first about osteoarthritis. What it is? Well, it's when the cartilage, which is the cushion, right? It basically protects the bones, starts to wear away, right? You get things like tenderness and stiffness and swelling and pain. Maybe you can't move so well. It starts to really wear you out. And so when this starts to happen, typically people will go, okay, I need to do something about it. And so there's really three solutions kind of. The traditional medical, they'll start with typically taking away the inflammation using steroid shots, which is very common. They'll either then in combination, they'll usually use medications. And if those things don't work, then that's when they opt for surgeries. So let's talk about cortisone. Now, it is a powerful anti-inflammatory, and it does help usually with short-term pain relief. But at what cost? I mean, what does it do? Because it weakens your immune system. Why do you think you can only get, I guess, 2 or 3 of them a year? Because it affects your health. It affects your blood sugar. It actually makes the tendons weaker. It softens the cartilage, and it really contributes to a more permanent weakening and damage of that area, where it leads to a faster wear and tear of a joint, in this case, a knee. Now, if you take medications, I mean, usually when I'm doing this live, I'll ask the audience, how many of you have taken a pain reliever in the last 7 days? So I'm going to ask you, you don't have to raise your hand because I can't see it, but how many of you have taken at least one pain reliever, like an Advil, Tylenol, I don't care what it was, but some kind of pain reliever for whatever reason in the last 7 days? And the sad fact is, if you're watching the seminar, most of you have done something, right? You've taken something to try to minimize pain, right? So there are prescriptive pain relievers out there that, you may have heard of: hydrocodone, oxycodone, methadone, codeine. These are highly addictive medications, and there's a epidemic going on with the addiction of people that have problems with these opioid type of medications as well, because they have terrible side effects. And medications in general just don't promote health. They're literally just a way to cover the problem somewhat, and hopefully that the problem goes away, but it usually doesn't. There's 100,000 patients in the hospitals every year from just taking NSAIDs like aspirin or Aleve or Advil. I know you're like, wait, what? That's not the prescriptions. The regular aspirin, Advil, or Tylenol or Aleve. These things can lead to hospitalizations for 100,000 patients a year. There's about 30 billion over-the-counter tablets sold every year. 30 billion. You think about it, if you ever go to like a Costco or something, you see those giant bottles of Advil, right? They have like 1,000 tablets. I mean, it's insane how many people are taking these medications and they treat it like candy when it's not. So when eventually the medications decrease their ability to function, then it's time, well, I guess there's no other choice but to do surgery. Now, surgery, especially joint surgery, is the third most common surgery. It costs about $26 billion every year. There's about 700,000 knee replacements, 300,000 hip replacements. There are serious complications that can occur. So, you need to be aware of that. Surgery is risky and painful, and a lot of times it fails. And you got to think about some situations. You say, well, maybe I have insurance. Do you? Well, how much is your deductible? How much will they pay? How much is your responsibility? Also, what about rehab, and what about downtime that you're going to have to be down because you can't work? So it's a risky, it's painful, it can cause complications. There are a lot of issues when it comes to doing joint surgeries. So in addition, people will typically have to have another surgery, which sucks, on the same area. And as you can see, comically, that he's not not entirely pleased with his hip replacement. I thought that was cute. So you've got the traditional model where you're only looking at symptoms, you're not looking at cause. And then we have a model called the regenerative, and it's really a different paradigm of looking at your health, and it's eliminating things naturally with pretty amazing results. Imagine what it would be like, just if you're having pain. Imagine what it would be like if it was you could go 6 months now into, let's say it's Christmas, and it didn't bother you anymore. It was gone. I mean, what would your life be like if you didn't have the pain that you're having, if you're having it? Would you be more active? Would you enjoy your life better? Would you have better relationships? I mean, what would it be like to gain more years of health to your life? 5, 10, 20 years of quality life. What would that be like? So let's talk about how we can potentially make that reality a truth. And this is called regenerative cellular therapies. And here's the thing, stem cells went through these phases, especially when I started 10 years ago. It was, first, people would ridicule it as fake and it didn't work. Secondly, then people started just opposing it because of the moral implications, saying that we were killing babies or cloning animals and stuff. And then once that was, eliminated and they stopped doing those type of treatments, then it's like, oh, must be, obviously it's self-evident. That's what people do now. And I would say stem cell therapy is really in the pretty much in the third phase, that most people know they have amazing abilities. So let's give you some basics on stem cells, what they do. A stem cell is a cell that can really become itself, reproduce itself, or become a different type of tissue. And they're responsible in the body to decrease inflammation where there's injuries, and stimulate regeneration of the damaged cells and tissues, so that you don't die, obviously. So the way they work is, there are primarily, now I mean, I'm oversimplifying, two main kind of cells. You've got your MSCs, which are really responsible for understanding what the problem is and creating messages on how to repair it. All right. And then you've got these tissue specific stem cells, niche stem cells, that are actually doing the repair and creating new tissue. So here's how we used to think about it. If you would have an injury, the stem cells would come out and they would become activated and they would heal the problem. Now, we found out that wasn't exactly what was happening. What happens is, you have an injury, the MSCs in the area, let's say it's a joint, come out, they figure out what's going on. They start to control the inflammation in the area. They also create little messages of instructions on how to repair something. It sends these little instructions out, and the tissue starts to get repaired from these specific tissue-specific stem cells. That's how it fixes it, as an easy way to look at it. So that's how it's working. Think of a stem cell in general as a foreman in a construction site. You've got this guy, he's telling all the workers what to do. Now, he's not the one doing the work. It's all these workers that are doing all the work, right? And it sends out these messages. And in the body, a cell produces messages that are called nanoparticles or nanovesicles or extracellular vesicles and exosomes. These are all really the same thing. They're just a container that has information on how to do a certain thing. As you can see with this diagram on the right, you can see that's a big stem cell. It's got these little particles that are being packaged up in a bubble. The bubble is a protection, and the little circles that are inside that bubble are the messages, instructions on how to fix something. It's sent out in the body. It goes to these specific target cells, and they start to do the function and work. So think about it this way: you go to do exercise. You're working out your legs, right? So what causes it to grow and become stronger is your legs, the muscle fibers start to get little tears, and the MSCs, the stem cells, come out. They stimulate the repair of the muscle tissue, and that's a constant process that's going on. Now, the challenge with using your own cells is the amount of stem cells that we have in our body. When we're young, or at least the newborns, 1 in 10,000. Now, when we get older, let's say you're my age, in my 50s, 1 in 400,000 is a stem cell. So I'm running on fumes in terms of my own cells. And that's why chronic issues become chronic issues. The body just doesn't have enough repair cells to fix it. And that's what happens as we get older. So, I mean, soon we can go down to Stem Cell Depot and pick up a different body part, but currently we're not able to do that. So what makes our body can really heal it? So there's different types of stem cell treatments that are available. You can use your own cells. Now, you can do these I would say use this if you're younger. If you're younger, then yeah, go ahead, use your bone marrow and your adipose tissue. You can get the stem cells from there, and they work really well. As you get older, though, they don't quite work as well, and you may need to look into alternative sources using amniotic fluid, placental tissue, cord blood, various allogeneic sources, which means it comes from somebody else. Now, let me talk about bone marrow. Bone marrow is, if you can see this little process here, we drill into the back of the hip, and we put a syringe into your pelvis directly and pull out the bone marrow directly. And then, of course, there's adipose tissue, which requires a liposuction procedure. Both of them are invasive and they are uncomfortable. And as you age, the ability of those cells and the strength decreases. And so they're just not as effective as they used to be. Now, the good thing about using perinatal tissue is there is tons of it available. There's lots of this perinatal tissue because people are having babies all the time. The younger cells tend to be stronger, and it doesn't require surgery. So that's why it's typically a more common procedure done. So the problem is knowing what you're getting from the clinics. You don't know what you're getting. If you go to a doctor's office and they tell you about stem cells, you're like, what do they know about it? Have they tested it? So the problem with using perinatal tissue, which is other people's, you have a lab that creates it. They process it, and then they put it into different vials in this term. And then the doctor typically buys it and then uses the product. But the doctor hasn't usually, on 99% of the time, taken the time to actually evaluate the quality of what they're getting. I bought a cell counter so I could really look at what what's going into our clients. So you can see this is a little screenshot of what I see. But basically, it counts the number of cells. It looks at the percentage of viability. I get all this data from this scanner. But unfortunately, your provider, if you know one, usually doesn't ever show you this or go over this with you. And keep in mind, if they show you one that's from just what's called a lot, which is a group, you don't know if that's what you're getting. This is actually what you get at that time, so you can really see it. So the benefits are immense of using these things. I mean, it stimulates metabolic activity, helps to heal, decrease inflammation, decreases need for surgery. It's an overall rejuvenator of the body. And we mentioned this before, but it helps so many conditions: knee, shoulder, hip pain, ligament strains. Now, what's interesting about it is it also can rejuvenate other issues, whether it be muscular as well as other tissues. You can use it for your skin as well. They use it under using microdermabrasion. So you can do like a laser or a device to stimulate and open up the barrier in your skin, and you can put these cells inside that, and either inject it or just put it on top, and it will stimulate your skin cells to repair itself and rejuvenate itself into a much younger version of yourself. So that's how you can use this for the joints as well as conditions of the skin. Here's a quick testimonial.
Okay.
So hopefully you can hear it.
Introduce yourself. I'm Larry Caldwell, and I've been a patient here for quite a few months.
And so what are we having done today?
We're having stem cell injection.
And tell us a little bit about your symptoms that you're having it for.
It's my knee. It's hard to get up and down because of the pain.
How long have you had problems with your knee?
About a year.
And what are the symptoms that you would have?
Just painful to try to get up, falling down.
Hi, I just want to tell you that how much the stem cell therapy helped my leg, my knee. I can't believe how much better I feel. I was somewhere between 5 to 8 days, but I had no problem with it. I had no inflammation. It feels so much better now that I've had it, and what can I say? I recommend it.
So anyway, there's lots of people that are doing these procedures. It's becoming very common. There's a lot of athletes you may have heard of course, these guys, Michael Jordan, Nadal, even Tony Robbins talks about it. And some of you, if you like wrestling, may recognize this guy. It's Diamond Dallas Page. He was actually a client of mine as well.
Page, former 3-time world champion professional wrestler. Being a professional wrestler for so many years, my body's really beat up, but especially on my knees. And I'm really close to, serious bone on bone. But when I heard the results that Dr. Ross Carter was getting with injections into the knee, I was all in because I wanted to try this. Within 4 days, I was right back to my regular routine. And so far, it's been about 3 weeks, and I'm feeling pretty good.
So you can see there's a lot of different people that are using this for various reasons. And it's something that's available to you as well. I could teach a lot. I do teach a lot. And knowledge is really not power. It's when you you combine it with action is really true power. So when you make a decision and you do something, is really when you have the power. And it really starts with a single decision. So if there's something you want to learn more about or interested in, I'm going to skip this one. But let's go over the questions I get, and then we'll answer your questions after this live. How many treatments will it take for your condition? Does it work with a bone-on-bone condition? Is there age limits? Is there any surgery? Does it hurt? How long does it take to see results? How long is recovery? What are our results? Should you go overseas? What is the cost? So let's go over those answers. There. How many treatments it's going to take? It's going to vary based on who you are, what condition you're treating. Is it one joint, or is it multiple joints? Is it another problem? It's really going to vary based on person, what's going on. It does work with bone-on-bone conditions to some degree. There's not really an age limit necessarily. You can do this as long as you're alive. Now, if you do perinatal tissue, then there's really no surgery. If you do your own, then yes, there is one, and those do hurt a little bit. I'm not going to lie. Even an injection in the knee or joint or whatever does come with some discomfort. It's a needle, so it's going to hurt a little bit. Results are pretty quick in terms of taking down inflammation, usually within a week or two. Our results for joint conditions have been outstanding. We're talking the 80 percentile range, which is fantastic. You can go overseas, but you don't know what you're getting, and that's a scary thing. And what happens if it doesn't work? We actually offer kind of like a satisfaction guarantee that if you do a procedure and you don't get results, you're not going to pay anything. So I don't know a lot of people that offer that. What does it cost? And we'll go through that. Here's what really affects your results. Lifestyle is huge, right? You've got your activities, lifestyle, smoking, drinking, all the things that you do that could be, that are negative to your health. And activities, if you continue doing what you did to cause a problem, it's not probably going to fix it. because you're going to continue to do it. So that really makes the difference of how to determine if you're going to get results or not. Here's the cost. Now it's going to vary greatly depending on where you go and all that, whether it be here or overseas. But as an average rule, typically for a procedure, usually you're 7,500 to 25,000 is the average normal range. Now, I know you'll see it online. I've seen it myself for cheaper at different, overseas. Like I said, I mean, just sometimes you get what you pay for. You got to be real careful with that. So the prices are typically based on how many joints are being treated, what your x-ray looks like or MRI, how many are done at the same time, what kind of treatment you're doing, and where you do the procedure. So just think about it. If all this did was really decreased your pain and took it in half, doubled the quality of your life, eliminated using medications and preventing you even from having surgery, is that something that'd be worth it? And for most of you, I would say yes. This is my information. If you or someone is having conditions and you want to find out if stem cell therapies will help, it's not just joint pain. It could be other conditions, whether it be autoimmune, longevity. Well, that's not a condition, but anti-aging procedures is very, very popular and common as well. We have a Young for Life program that's really interesting. But anyway, if you're interested, you can talk to me for free. It's normally $300 on my website. You'll see. But if you use the code FREE, it will give you it'll actually take off that charge. So it's my gift to you for no charge. So you can scan the code, go to the site and schedule a time to talk with me, and we'll be able to figure out if this is something right for you. I think that's everything. Yep. So I am going to go back to here and be back here. Oh,
okay. Hi. Oh, as usual, I learned so much from all of this, and it just got me thinking. So I don't have any joint pain yet, and hopefully not at all in the future. But my dad recently did start getting some in his knee, and they went in and told him like surgery and all this kind of stuff. And I was like, oh my God, well, there's another way. Why is this not told to people? And as you mentioned, knowledge is power. Money. I imagine, yeah.
Doctors make a lot of money on surgery.
Oh, yeah.
They do.
Gosh, that's frustrating. But thank you. Exactly. It's something that we know now. And I just like floated it by him, and he's like, what is that? So he has some questions that I'm going to go ahead and bring over to you. He's like,
let's do it.
All right. So he asked if there are any side effects, what kind of side effects you can expect after getting the therapy.
Side effects. I mean, for negative ones, you can have inflammation at the site of injection. That's common. Some people, with any procedure, there's always something that could happen. You could get worse. I just never seen that happen. The side effects that I'd seen is just not improvement of the symptoms. Right. And usually, if we screen properly, we can usually filter out a lot of those people. And the people that aren't responding in general are the ones that are not actively taking care of their health. This is not a magic bullet that solves all problems, and you can continue your lifestyle of sitting on the couch watching TV, eating Cheetos all day and expect your health to transform into this wonderful, healthy person. That's not realistic. But if it's in combination with you taking great care of yourself, then your results should be fantastic.
Nice. Okay. This may be a little specific. We'll chat later. There's a question on here. Do you know of any Canadian practitioners that offer this as a procedure?
I do not. I don't think it's allowed in Canada. I have clients. I've had clients from Canada come down for the procedures because of that. So yeah, it's really difficult to get. These are always considered experimental. So just know that you're doing an experimental style procedure.
Okay. Good to know. And then I see another question on here. That is this. And you may have touched it when you answered the first question. Like, how many sessions does it take? But it's kind of like, is this something that needs to be done recurring, like, or is it like a one and done kind of deal?
Depends on the condition. If you've got a chronic problem that's lasted a long time and you need a lot of work, then maybe it's going to take more. If it's like I had an injury, right, but I was a healthy athletic person. So for me, it was just a one and done, and that was all it took to fix my problem. So it's really going to depend on the person's condition, their environment, what it is they're trying to accomplish, things like that.
Okay, nice. Let's see. I see a question here that says, I found a regenerative group in Albany called QC Kinetics. Have you heard of them?
Yeah, I have. They're kind of like a chain of clinics that are working together. I cannot comment good or bad with the clinic if you do go there.
Right.
I would want to. I don't know what they charge, and I don't know actually what. I assume they're doing perinatal procedures, but they may not be. I'm not sure. So one thing I would do is find out: do you guarantee your service? That's a big thing. So what happens if I don't get any improvement? What happens then? And they go, well, you get to pay for another procedure or nothing, So really ask them that question. Also, if they're using perinatal tissue, do they have a tool to evaluate the quality of the cells that they're using, and how many are they going to use? And then make sure that what they say they're going to use and what you see on a screen like I showed you are the same. Because I have yet to run into that. Well, no, it's happened one time. I went to a clinic. They said it was going to be this many cells, this percentage. I tested it. It was exactly right. It was exactly what it said.
Okay.
But that was kind of a unicorn, it seemed, because everybody else's were never, they would always exaggerate things. They'll say how you're doing, 20 billion or million or whatever number of cells, and you're like, and then they'll give you a cell count, but not a stem cell count. They'll go, you got 20 million cells. How many stem cells out of that? Oh, well, only 1% of those are really stem cells. A lot lower than you think. So it's really difficult when you're going in as general public, because they're just going to have their sales presentation. That's what happens when these chain clinics get together. They have a standardized presentation that they give everybody.
Yeah. Well, that's unfortunate, but so like, I guess you mentioned like just knowing whether it's accurate, the test is accurate, how many they're saying they're going to give you, how many cells are in it. How would one go about verifying that? I mean, you're a doctor, so you have access to labs and all that, but if I were going.
Well, that's really difficult for you as a consumer to really know, unless they actually ask them if they have a cell counter that they can show you exactly how many cells you're getting. And what they'll have usually is just a sheet that they've been given from the company, and it just applies to, they say, every product. But all of these products are cellular based. They're all from a person. They're going to vary. They're going to have variations of different things. So you need to be able to know what you're getting specifically. So do they do it in front of you? If you're using your own cells, then that's great. You can look and make sure that they're still alive. They should have a counter when they do that. They should be able to show you what your cells look like and how viable they are. They should be very good. But when you freeze cells and then thaw them, a lot of them will die if they're not done properly.
Okay. Yeah. This is always, I guess, the case when you're at the forefront of medicine, right? People will pop up and try to capitalize on it. And then you have to, as a consumer, you have to just know the questions to ask.
Yeah. Yeah, you're right.
So then I guess going along that, what are some questions apart from the ones that you've already shared with us that you would, if you were just coming into or interviewing a doctor for potentially doing this procedure, what are the important kind of questions that you want to know?
Where do you get your product?
Okay.
Does it have an FDA regulation? Is the lab been evaluated by the FDA? Cell count, if you can get it. Is it from a vaccinated or unvaccinated donor? Good to know.
Okay.
Some people are the unvaccinated products are super popular compared to the other ones. So, and find out the training of the provider. I mean, did he go to a weekend course? Has he been doing this for 10 years?
Right.
Does he have testimonials of people? Most of them do, but a lot of those could be kind of not real. So you got to be careful. But it is a challenge in this industry. It really is.
Okay. So basically, everyone, go with Dr. Ross because he knows what he's talking about.
I can help guide you in where to go if you're interested in these things. I can share with you. There's a clinic that I work with. I really like their products. They're out of Los Angeles. They're out of Austin, Atlanta, Miami, and West Palm Beach. So they've got locations in different places you can fly to.
Nice. Okay.
Now I see a question here. It says, do I need the serum to use with a derma wand?
That's for our product. That's for the My Derma Dream, the wand that we sell. It's a 5-in-1 kind of skincare rejuvenation wand. That's what we call it.
Right.
That's not what you'd call it, but you kind of just rub it along your face. It has microcurrent. It has LED lights. So honestly, for the wand, I don't use a serum. Just to clarify for the user, I just use it on my.
Does it open up the skin?
It does not.
Okay, so if you're using a stem cell product that I would use for skin would be exosomes. Exosomes are the product that you would want to put on your skin. It's not going to. You need to open up the skin a little bit so that they can get inside. But exosomes, which is spelled EXOSOMES, exosomes. And if you want to get some of those, let me know. I can help anybody get those. But those are great for skin. They do amazing rejuvenation. On one of my other presentations, I had a before-after person that had severe burns, second-degree burns, and after 2 months, he had no signs at all of any kind of damage to his skin. So I don't have that right in front of me, but
that you shared, I believe, in one of your earlier presentations. Yeah.
Yep, I shared that with that. And those are the little particles called stem cell exosomes. It's really the active ingredient, like I mentioned in this presentation, of how stem cells function. So you get a concentration of those and you can put them internally or externally, and they just do magical things.
Wow. And what are we talking cost-wise for those?
For an exosome procedure, if you're doing it for your skin, you don't need as much as you're doing it for your internally. So usually in the $2,000 to $3,000 range.
Okay.
And it's spelled, I see that somebody's asking, EXO, like XO, EXO, SOMES, SOMES, exosomes.
All right.
Yes, you got it.
Exosomes. All right. Amazing. I mean, my dad is actually in Miami, so I may be asking you about that.
We can help you there.
Yeah, absolutely. Well, thank you so much. I'm looking here. Let me check into YouTube if we have any questions directly. Oh, someone mentioned that they were a massage practitioner and a bartender constantly on their feet. Is that a treatment area that we could potentially look at, or I guess stemming from that, is there any area of the body that is limited with the procedure?
No, you can treat any kind of issues. It could be in the joint or not, or it could be muscular.
Interesting. Okay. Great. All right, then. I think those are all the questions that I see on this end. Thank you so much then, Dr. Ross. I will go ahead. I took a screenshot of the QR code that you shared, I'm going to share it in our Facebook group. So anyone that's watching in YouTube, and if you're interested in getting that screenshot again, please head over to our Facebook group. I will go ahead and put it in the chat just so you can have it.
And make sure to put that the word free in the coupon code thing, and that'll change the price from $300 to $0. So
amazing. That's amazing. Well, thank you so much, everyone, for joining us today with Dr. Ross Carter. Next week, we won't be having any lives next week, but the following week, we will be with Lindsay talking about supplements and things that will help your skin and all that great stuff. So tune in then. I will put it out on our Facebook group. And again, thank you so much, Dr. Carter, for joining us. And thank you, everyone who showed up today.
Thank you so much. It was a pleasure.